Back from Henry Ford Jackson Hospital and IEP Urgent Care Emergency Services physicians, Dr. Jacob Sinkoff and Dr. Nicolaus Hoggan. Welcome to the show.
Good morning. Thanks for having me again.
It's actually Dr. Hoggan's first visit here.
It is.
And you're a resident.
I'm a resident physician, yeah.
What does that mean?
So I've been out of med school for a few years. You go to medical school and then you pursue specialty training in whatever you are interested in my case, emergency medicine. So for us, it's 4 years of training in the ER and a little bit of everything else, so you're ready for whatever comes in the door. So I'm actually about 6 weeks from being done with my 4-year residency.
Awesome. Where are you from originally?
I grew up in California, San Jose.
Do you only bring people in from California?
We've had a couple California. We try to get people from Michigan. We like keeping home state people, but
I've been playing this close to the chest, but I was actually born in Rochester Hills.
Okay, all right, there you go.
So yeah, we try to get people from Michigan, and Henry Ford Jackson's been a training facility for coming up on 10 years now. July 1st is kind of transition when we get new interns and residents, and our residents graduate. So Nick's been here 4 years, and he's signed on, and we're gonna be jealous. You guys are gonna be jealous.
Headed to Hawaii.
What?
Got a job in Hawaii.
Which island? Come on, just
Going to the Big Island, going to the town of Hilo.
Oh yeah,
My mom was born and raised out there.
Okay.
So I was out there for a few years working on the ambulance before going to medical school and
It
going
can
back.
get a little seedy in Hilo. It's not all fun and games out there.
Rainiest city in the country, actually.
Awesome.
Yeah.
Awesome.
Well, Jake, you'll have a place to take your family for
Exactly.
vacation.
We always try to keep our residents here in Michigan, but the ones that leave, we always have pretty much somewhere to stay now. This is our Nick will be our first
Come on
resident to
out
go to Hawaii, but we have residents all over the country.
That's awesome.
Now. Yep.
Well, we've got the holidays coming up, and it's holiday injuries. We want to talk a little bit about golf carts.
Yeah.
Why is it? Well, it seems like golf carts, when mixed with alcohol, just turn into like a large toy.
Yeah, I mean, I think they start out, people think they're right? A large toy, and then the alcohol kind of brings it on. And I know you had just been mentioning about lakes, like, I live on the lake, and the golf carts are everywhere nowadays. And those things, they're like cars.
Well,
they cost like a car. They cost
the
as
more
much
money
as a car.
you put into these things, and they do. And of course, people want to drive them. A car versus golf cart, who's going to win that one?
Yeah, they car a lot of times.
Yeah.
In the person versus golf cart, the golf cart will win that.
Right.
Will win that. And the other thing we've noticed is a lot of minors driving golf carts, especially I'll see it personally along the lake, and we get a lot of golf cart injuries. There's actually been a lot of literature through trauma journals about golf cart. There's so many nationwide that they're reporting out a lot of injuries from golf carts, and they seem so simple, It's like my 8-year-old can drive that thing, or a 12-year-old, and we see a lot of pediatric
I have a
injuries.
bad habit, and I've been trying to fix it. If I'm driving the golf cart, my left leg is just
Hanging
relaxing.
out of the cart.
I can't, and I can't. There's nothing I can do about it. I could break my leg any time.
Yeah.
Easily.
And Andy has a lifetime ban at Concord Hills golf course.
Yeah, I'm sorry. I was 8 years old, flipped a cart into the river. Big deal.
And your nephew, 8, he was driving a golf cart last summer.
Jim, and he
didn't know how to brake.
So he
crashed.
He crashed.
Yep.
He crashed.
Yep.
And I think that was the last time, and I think his family learned a lesson.
I do think his family learned a lesson.
Yeah. So we might, just here in Jackson County, we might have to start a study. We see so many golf cart accidents, and probably the majority are not. We get them from golf courses, but a lot of them are just non-golf course related. And like I said, a lot of pediatric. So be careful. Probably very important to have adult supervision when your kids are driving golf carts too.
Nick, how about lawnmower incidents? When I was young, I don't know if you remember this, but you actually had forced me to mow the lawn at a young age, and the blade wasn't working, and I think you said just fix it. And
your memory of your childhood is...
So I had a butter knife, and I was trying to get the stuff out of the blade.
That part might be true.
And but there's a lot of lawn mowing incidents around here.
Yeah, and there's a startling number of lawnmower-related accidents in our community, and I assume it's not just our community.
Right.
I know very little about lawnmower repair, but I do know 100% you have to turn it off first.
Yes.
It sounds insane to have to say that out loud, but I've seen a number of patients over the last 3.5, 4
Yeah.
years with terrible injuries because they were fixing a lawnmower that was still going.
Right.
Yeah.
Yeah.
Feet as well.
Yeah, you think like, the blade's not engaged, but if you leave the lawnmower on, then you kind of manipulate the mower and then
Yeah.
press it,
Right.
lifting it up, just trying to get it, then it engages the blade. It's all the time in the summer. So
Also see a startling number of lawnmower-related injuries of riding mowers and people falling off. They get on
Really?
the hill or they
Okay.
going up and they fall backwards, and you got to watch out.
Well, those zero-turn lawnmowers, you could tip.
Well, depending on the topography, yeah, for sure.
yeah, I've got one of those, and they go pretty quick, man. Those
Yeah.
things go fast, just like the golf carts. They go fast. Yeah, so they can get going, especially when you get on the a ledge. They tip rather easily. So.
Soon we'll see people on the waters and jet skis, boats. We'll have ATVs. Really, all these kinds of recreational vehicles. They are. Could be a recipe for.
Yeah, just because they're smaller doesn't mean they're any less dangerous.
Right.
So just being safe, and they're a lot of fun. So just be safe and be conscientious of, the injuries that can happen.
You guys have any holiday plans other than working? I'm sure there'll be some work involved. Any holiday plans coming up?
Yeah, I think for Memorial Day, I believe it's my week, my year off. So I worked last Memorial Day, so I'll be off this Memorial Day. So I think the weather's supposed to be looking pretty nice.
I hope so.
The 10-day forecast. So hopefully it stays like that.
What kind of emergency issues are there going to be in Hawaii at your new station?
Same thing there are here.
Sharks?
I have, I think, seen one shark bite. I was out there for about 6 years working on the ambulance.
Sea turtles, though, they could bite.
They could. That'd be your fault, though. You would actually get
right.
Federal, you get in trouble. You get a fine if
Yeah.
you're close enough to a sea turtle to get hurt.
Yeah.
That's on you. So you get that bite and you get that ticket.
If it happens, could I still come see you? Treat
Absolutely.
me though. All right.
Absolutely.
In emergency, we have said we don't judge.
That's right.
We do not judge. So accidents happen to everyone, can happen to anyone, and they happen all the time. So we do not judge. So.
Yeah, because if someone's injured by sticking their hand under a running lawnmower, they probably feel stupid.
When they should. I mean,
They should, but also there's nothing that I'm going to say that's
Right.
going to make this
it's
less terrible.
right. You're not there to discipline them.
Yeah, for sure. And we get those patients like, oh, must be the stupidest thing. I was like, this isn't the
is
stupidest
not,
thing
yeah.
I've seen today. So there's nothing nothing's ever the worst.
So in your time here at Henry Ford and IEP, what's been your impression of our health system and our community?
Yeah, we have a great community here. We have a great town, a great community, and we're fortunate enough to have a great group of providers, nurses, doctors, techs, the whole system out there. I came out here in 2019, just before the pandemic hit, and so my time here has been, flavored by that or colored by that, and it was really cool to see the system come together in a time of crisis and the community backing everybody up. It's a privilege.
Well, it's unfortunate we lose you, but it's Hawaii's gain, I guess.
Super grateful for my
Yeah.
time here.
Yeah.
Great to have you part of our community, and thanks for coming in today.
Absolutely.
Thank you, guys.
Helping to keep our community safe in the ED and at IEP, Dr. Jacob Sinkoff and Dr. Nicolaus Hoggan.